You've had your mastectomy or your lumpectomy surgery and you're really eager to be fit with your prosthesis because, you want to get back to yourself. So, when can you be fit with your prosthesis? That's a great question. Hi, I'm Sherry from Twin Sisters Mastectomy Boutique. And this question comes up a lot. Women are very eager to get their breast prosthesis because they want to restore their silhouette, they want to start feeling like themselves again, and they're very eager. So, when can you be fit? That's a really good question with a lot of conflicting answers. So, first of all, we want to make sure that you're healing properly. So, you want to make sure that your drainage tubes are out, that you don't have any bandages left, you don't want any seepage or oozing of wounds. Everything needs to be nice and healed on the outside. And then we want the majority of swelling to be down. Now, I say the majority because surgeons have told me, and I'm not a doctor or a nurse, but surgeons have told me that swelling for any kind of surgery, even like rhinoplasty, can take up to 2 years to dissipate. So that's a long time, and nobody's going to wait 2 years for their breast prosthesis. But at about 4 to 6 weeks, the majority of swelling has gone down, and we can get an accurate fit for your prosthesis. So we also want to make sure that your insides are healed. So even though the outside of your body may look healed after a couple of weeks, we're still going to wait a little bit longer because we want to make sure that you're healed on the inside. Your body's been through a lot, and we don't want to put any extra strain on it that could give you a setback. Now, if you look online, when to be fit with a breast prosthesis, a lot of different organizations will say 6 weeks and beyond. And that's pretty conservative. Your healthcare team may tell you 4 to 6 weeks. So who do you listen to? Well, always, always, always default to your healthcare team and your doctors and your surgeons because they know your particular situation. And, what we read online is general information. Now, I've had some surgeons, send their clients to me or their patients to me, after 3 weeks. And I always double check with them. I'm like, are you sure you want me to fit them? And yeah, okay. They're the doctor. They know how the patient is healing. They, have their full record and I don't. And some doctors and surgeons will say, no, I want my patient to wait 8 weeks. Absolutely. Again, it doesn't mean that something went wrong with your surgery. It just, that's where your doctor's comfort level is. Maybe they used a different technique. Maybe, given your health history, this is what's best for you. So always, always, always follow the instructions of your doctor and your healthcare team. In my boutique, we generally fit between 4 and 6 weeks. But again, that's always with a, consent of the surgeons or the healthcare team, and we pretty much stick to that. I generally don't like to fit people before then. I also, have concerns about fitting people too far after their surgery. So sometimes, especially during the pandemic, people came a year after their surgery or 2 years after their surgery or even 6 months. And that poses its own set of problems. Now, if that's what your surgeon, your doctor, your healthcare team recommended, absolutely follow that. But if that's just something you're doing on your own, because you didn't know when to be fit, then you should go in to see a fitter sooner than later. The reason is your body is balanced, equal weight on one side than the other. So if you've had a single mastectomy, for instance, now you have more weight on one side than the other, and your back and your body is compensating for that. And what happens is you can often develop neck, shoulder, and back pain because your body is now not balanced, and that can cause its own set of problems. And so it's not uncommon for me to fit somebody with a prosthesis after they've had their mastectomy surgery and they've waited for a year, and they put on the prosthesis, which is weighted to about 30% of breast tissue, and they put it on and they go, oh my God, this feels good, because their body is all of a sudden aligned and in balance. Their biomechanical balance, the distribution of weight is all lined up. and they feel really good. I find the same thing when people tell me that, I'm working from home and I'm not, wearing my prosthesis at home, because who wants to wear a bra and prosthesis at home? And then in the conversation, it'll come up that they're having back pain or neck pain or something. And I'll say to them, try wearing your prosthesis all the time, all day long, except when you're sleeping. And then they'll call me up a week later and go, oh my gosh, this is fantastic. My back pain's gone. Now, I'm not saying that's going to work for everybody. And again, I am not a doctor or a nurse, but your body is smart and your body knows when it needs that biomechanical balance. So we don't want to rush you into wearing a prosthesis, generally not before 4 weeks. And we don't really want you to wait too far beyond 6 weeks. So, in my boutique, 4 to 6 weeks is the gold standard, but always follow the instructions of your doctors, your surgeons, your healthcare team, because they know what's best for you. I hope that helps, and please like and subscribe.